Rude nurse mocks patient, but later stunned to learn. He's the surgeon leading her evaluation. A nurse dismissed a patient and treated him as though he was beneath her. Moments later, she found out he wasn't just a patient. He was the lead surgeon conducting her performance review. It was a crisp Monday morning at St. Mary's Hospital, and the sterile hallways hummed with the usual mix of efficiency and urgency. Nurses darted between rooms, doctors reviewed charts on the move, and patients waited for their turn with tired, hopeful eyes. Amid the bustling energy, Nurse Rebecca Carter walked briskly into the day's shift briefing. She was known among her peers for her efficiency, but also for her sharp tongue and an air of superiority that set her apart. Rebecca prided herself on being meticulous in her work, but she often carried her confidence too far. To her, there were unspoken hierarchies in the hospital, between nurses and patients, doctors and staff, and even among her own colleagues. It wasn't just skill that dictated her treatment of others. It was perception, and her perceptions often bordered on prejudice. "Today's rounds are heavy," her colleague Maria said, handing Rebecca a clipboard. "Be prepared for the usual." Rebecca smirked. "Usual? You mean patients who think they know more than we do?" she said, rolling her eyes. Maria frowned. "They're just people who need help, Rebecca. Try to remember that." Rebecca didn't respond, instead flipping through the patient list with detached interest. Her next stop was room 312, a patient who had come in with mild symptoms but had insisted on a more thorough evaluation. "Typical," she muttered under her breath, making her way down the hall. She pushed open the door without knocking, her tone brisk. "Good morning. I'm Nurse Carter. Let's get this over with." The patient in the room turned from the window, a man in his early 40s with dark skin, neatly trimmed hair, and an understated confidence that seemed out of place in Rebecca's eyes. He was dressed casually in a sweater and slacks, his posture relaxed but alert. "Good morning," he replied, his voice calm and measured. Rebecca barely glanced at him, scribbling something on the clipboard. "Name?" He raised an eyebrow, clearly catching the sharpness in her tone. "Dr. Ellis Jackson," he said, his tone polite but firm. Rebecca paused briefly, but instead of acknowledging his title, she scoffed lightly. "Dr. Jackson, huh? Well, let's just focus on why you're here, shall we?" The tension in the room thickened as Rebecca began her questions, her demeanor growing more dismissive with each passing minute. She tapped her pen on the clipboard impatiently, barely glancing at Dr. Jackson as she fired off questions. "Symptoms?" she asked curtly, not even pausing to hear his full response. "Well, I've been experiencing some—" "Short answers, please," she interrupted, waving her pen in the air dismissively. "I just need the basics. This isn't a dissertation." Dr. Jackson paused, his expression calm but observant. Fatigue, occasional shortness of breath, and some lightheadedness. Rebecca nodded but didn't look up, scribbling quickly. "Lightheadedness," she muttered to herself, her tone dripping with skepticism. "And I assume you think it's something serious?" "It's enough to raise some concern," Dr. Jackson replied evenly. "Sure it is," she said under her breath, adding, "Everybody's a medical expert these days." Dr. Jackson arched an eyebrow but said nothing. Rebecca finally looked up, her eyes flicking over him briefly before landing back on the clipboard. "Do you smoke?" "No," Dr. Jackson replied. "Alcohol?" "Occasionally." "Define occasionally," she said, raising her eyebrows and tilting her head like she didn't believe him. "A glass of wine every few weeks," he replied, his tone measured. Rebecca smirked. "Right. And I suppose you're going to tell me you exercise regularly too." "I do," Dr. Jackson said, maintaining his composure. Rebecca snorted. "You're really hitting all the textbook answers, aren't you? Next thing you'll say is you're vegan." She let out a small laugh, then scribbled something on the clipboard. Dr. Jackson didn't react to the remark, but the flicker of disappointment in his eyes deepened. "Look," Rebecca continued, leaning against the counter with a hand on her hip, "these sound like pretty generic symptoms. Honestly, most of the time it's nothing. Stress, dehydration, maybe a lack of sleep. You probably Googled something scary and decided to come in, right?" Dr. Jackson's calm demeanor remained steady, but his voice was firm as he replied, "I prefer to base my concerns on more reliable sources than the internet." Rebecca froze for a moment, caught off guard by the subtle pushback, before shaking her head and chuckling softly. Well, that's what we're here for. I'll have the basics checked, but don't expect any groundbreaking discoveries. Sometimes a little reassurance is all people need to stop overthinking. Without waiting for a response, she handed him a clipboard with forms to fill out. You can wait for further instructions once you're done, she said brusquely, already turning toward the door. Dr. Jackson glanced at the clipboard, his expression unreadable. Thank you, Nurse Carter, he said evenly. And Rebecca left without a backward glance, muttering under her breath as she walked down the hallway. Some people really think they're special, she said with a smirk, shaking her head. What Rebecca didn't realize was that her behavior hadn't gone unnoticed, and the man she had dismissed so casually wasn't just a patient. He was the head of the hospital's surgical department and the lead evaluator for the nurses' quarterly performance reviews. Dr. Ellis Jackson leaned back slightly in the stiff chair after Nurse Rebecca Carter left the room, his calm demeanor belying the thoughts running through his mind. Years of experience had taught him to remain unshaken in the face of bias and disrespect, but her behavior was a stark reminder of why he had fought so hard to climb the ranks of his profession. This wasn't the first time he'd been dismissed or underestimated. As a black man in medicine, Ellis had grown accustomed to having to prove himself twice over, once for his expertise and again for his humanity. The journey to his position as chief of surgery hadn't been easy. He thought back to his early days in medical school when professors had hesitated to call on him in class, despite his consistently high marks. He remembered his first residency interview vividly. The panel had glanced at his resume, then at him, and then back again, their skepticism poorly hidden. Dr. Jackson, these credentials are impressive, one of them had said, as though they were surprised he'd written them himself. Moments like these had shaped him, molding his patience and resolve. But the moment with Nurse Carter stung in a way he hadn't expected, not because of her dismissal of his title or credentials, but because her behavior reflected a deeper issue he had spent his career trying to combat. Ellis glanced down at the clipboard she had handed him, noting her hurried, almost illegible scrawl. It was a small thing, but it spoke volumes about her lack of care and respect. He wasn't offended on his behalf. He thought of the countless patients who might have faced her dismissiveness without the knowledge or confidence to push back. He ran a hand over his neatly trimmed beard, his thoughts lingering on the moments he'd observed in the hospital over the years. Patients whose concerns were brushed aside, staff members who were overlooked or undervalued. Rebecca Carter's behavior wasn't unique. It was emblematic of a larger problem. Ellis stood and handed his clipboard to the nurse at the desk, his posture calm yet purposeful. He decided to take the long route back to his office, observing as he passed through the halls. It didn't take long to notice Rebecca again. She was standing near the nurse's station, speaking to a younger colleague, a junior nurse who looked barely out of training. The conversation wasn't loud, but it was tense enough to catch Ellis's attention. "Did you double-check the medication dosage before handing it over?" Rebecca asked, her tone sharp. "Yes, I did," the junior nurse replied, her voice steady but a little hesitant. "Well, next time, don't just think you did," Rebecca snapped, crossing her arms. "Mistakes like that can cost lives. Maybe you should spend more time on your charts and less time socializing." The younger nurse flushed, her cheeks a deep crimson. "Yes, Nurse Carter," she said quietly. Rebecca huffed, muttering something under her breath before walking away, leaving the junior nurse staring at the floor. Ellis watched the exchange silently from a distance, his jaw tightening. It wasn't just her condescension that bothered him. It was the lack of guidance, the complete absence of compassion. As he continued through the hospital, he noticed other small moments that painted a fuller picture of Rebecca Carter. A patient in the waiting area asked her a question, and Rebecca responded without breaking stride, tossing a curt, "Ask someone else, I'm busy," over her shoulder. Another nurse politely called her name, asking for assistance with a tricky procedure. Rebecca glanced over, her brow furrowing. "Figure it out," she said dismissively. "I'm not here to hold your hand." Ellis paused at the corner of a hallway, folding his arms as he observed her move through the day. She was efficient, yes, her movements quick, her hands steady, But it was clear she saw the people around her as obstacles to be managed rather than individuals to be cared for. It wasn't just a bad attitude, it was a pattern. Ellis sighed, shaking his head slightly as he resumed his walk to his office. He couldn't shake the thought of the young nurse's downcast eyes or the hesitant voice of the patient Rebecca had brushed off. She might not even realize the impact of her words, but that didn't make her behavior excusable. Later that day, Ellis received a message on his phone, a reminder about the quarterly nursing evaluations. He placed the phone back in his pocket, his mind already turning to how he could address her behavior. Rebecca needed to understand that medicine was about more than precision and efficiency. It was about people. And if she wasn't willing to embrace that, she didn't belong at St. Mary's. The evaluation room was quiet, save for the shuffling of papers and the occasional murmur among the evaluators as they reviewed the files. Rebecca Carter stood outside the door, clutching a folder of her own. Her face was composed, but the tension in her posture betrayed her nerves. She smoothed her hair, adjusted her uniform, and took a deep breath before pushing the door open. Inside, the evaluators sat in a semicircle around the table, their expressions professional but unreadable. At the head of the table sat Dr. Ellis Jackson, his demeanor calm and composed. Rebecca froze for a moment, her stomach dropping as her eyes landed on him. "Good afternoon, Nurse Carter," Dr. Jackson greeted smoothly, his tone polite but firm. "Please take a seat." Rebecca hesitated but quickly masked her discomfort, straightening her back as she walked to the empty chair. She set her folder on the table and folded her hands in her lap, trying to steady herself. One of the evaluators, Dr. Patel, spoke first. "Nurse Carter, your clinical skills have been noted as consistently proficient, and you handle high-pressure situations well. However, there have been some concerns raised regarding your interpersonal conduct." Rebecca blinked, her confidence wavering. "Concerns?" she repeated, her tone tinged with disbelief. Dr. Patel nodded, glancing briefly at Dr. Jackson before continuing. "Specifically, your interactions with patients and colleagues have been described as dismissive at times." Rebecca opened her mouth to defend herself, but Dr. Jackson leaned forward, his steady gaze silencing her. "I had the opportunity to observe you firsthand during today's rounds," he said. "And while I agree that your technical proficiency is solid, there were moments that raised red flags." Rebecca's face flushed and she shifted uncomfortably in her seat. "I don't understand," she said, her voice sharp. "I've always been professional. My patients get the care they need, and I make sure the job gets done." Dr. Jackson's voice remained calm, but his words carried weight. "Professionalism isn't just about completing tasks, Nurse Carter. It's about how you treat the people you serve and the people you work with. Today I witnessed you dismiss a patient's concerns, belittle a colleague, and brush off requests for assistance. That's not professionalism. That's arrogance." The tension in the room was palpable. Rebecca's hands clenched in her lap, her mind racing. She glanced around the table, searching for support, but the other evaluators remained silent, their eyes fixed on her. Dr. Patel cleared his throat. "This isn't the first time these concerns have been raised, Nurse Carter. We've received feedback from other staff members and even a few patients over the past year." Rebecca's head snapped toward him. "Why wasn't I informed of this sooner?" she demanded, her voice rising. "You were informed," Dr. Jackson said evenly. "There were multiple meetings with your supervisor to address these issues, but it seems the feedback hasn't been taken to heart." Rebecca's breath hitched as the weight of the situation began to sink in. Her mind reeled, struggling to reconcile the confidence she'd walked in with and the scrutiny she now faced. Dr. Jackson leaned back in his chair, his expression steady but resolute. "This isn't about punishing you, Nurse Carter. It's about accountability. The way we interact with others reflects the values of this hospital. If those values aren't upheld, it undermines the trust our patients place in us." Rebecca swallowed hard, her composure cracking. I didn't realize." Dr. Jackson raised a hand, silencing her. "You'll have a chance to speak, but we aren't done here yet." The tension in the room hung heavy as the evaluators exchanged quiet glances. The room seemed to shrink around Rebecca as the evaluators quietly shuffled their notes, their expressions remaining unreadable. Her mind raced as she tried to salvage her crumbling confidence. "Nurse Carter," Dr. Patel began, breaking the silence. Before we continue, do you have anything you'd like to say in response to these observations? Rebecca hesitated, her palms sweaty as she gripped the edges of her folder. I, I've always believed in being efficient and precise, she said, her voice trembling slightly. Sometimes that means cutting through unnecessary chatter to get things done. It's never been my intention to come off as dismissive. Dr. Jackson leaned forward, his fingers steepled, his calm but piercing gaze locked onto hers. Efficient and precise are good qualities, Nurse Carter, but not at the expense of empathy. Do you recall the patient in room 312 this morning? Rebecca stiffened. Yes, she said, forcing her tone to remain steady. Dr. Jackson tilted his head slightly, his expression unwavering. Do you remember how you spoke to him? Rebecca blinked, her breath catching. I was direct. It's important to get to the point with patients. They don't always understand the medical process. There was a pause, heavy with unspoken meaning. Dr. Jackson's voice remained calm, but there was a distinct edge to his words. Direct, Nurse Carter? You interrupted him. You dismissed his concerns as trivial. You accused him of Googling his symptoms and wasting time. Her face burned as the memory came rushing back in vivid detail. I didn't mean it that way, she said quickly, her voice defensive. Intent doesn't erase impact, Dr. Jackson replied, his voice firm. How do you think that patient felt when you spoke to him that way? Rebecca opened her mouth to respond, but no words came. The weight of his question hung in the air, and she felt the eyes of every evaluator in the room on her. Rebecca opened her mouth to respond, but no words came. The weight of Dr. Jackson's question hung in the air, each second dragging like an eternity. She felt the eyes of every evaluator in the room on her, their collective silence pressing down on her like a lead blanket. Rebecca started, her voice faltering. I suppose he might have felt disregarded. Dr. Jackson's gaze remained steady, his tone calm but unyielding. Disregarded, he repeated, the word cutting through the tension like a scalpel. Tell me, Nurse Carter, is that how you want your patients to feel? Disregarded? Rebecca's throat tightened as she forced herself to meet his eyes. No, of course not, she replied quickly, her voice trembling. I only meant to be efficient. I didn't realize I was... You didn't realize because you didn't take the time to, Dr. Jackson interrupted. His voice wasn't raised, but the weight behind it was unmistakable. You treated him like an inconvenience, not a person. The evaluators remained silent, their expressions a mix of disapproval and contemplation. Rebecca felt her pulse pounding in her ears, her confidence slipping further with each passing moment. Dr. Jackson continued, his tone sharpening. And what about your colleagues? You spoke to a junior nurse today in a way that was, frankly, unacceptable. She came to you for guidance, and instead of offering support, you belittled her in front of others. How do you think that affected her confidence? Rebecca blinked rapidly, her face burning as the memory resurfaced. I didn't mean to discourage her, she stammered. I was just trying to make sure she understood the importance of being thorough. By embarrassing her? Dr. Jackson's question landed like a blow. This hospital isn't just about individual competence, Nurse Carter. It's about collaboration, about creating an environment where patients and staff alike feel respected and valued. When you undermine that, you undermine all of us. The room was heavy with silence as Rebecca struggled to form a coherent response. Her palms were slick with sweat, her folder crumpled slightly from the pressure of her grip. Dr. Patel cleared his throat, breaking the quiet. Rebecca, he said gently but firmly, this isn't just about today. There's a pattern here, one we've seen reflected in previous feedback from patients and colleagues. This isn't the first time we've had this conversation. Dr. Jackson's gaze softened slightly, but his tone remained resolute. You're skilled, Nurse Carter. There's no denying that. But skill without compassion is a liability in this profession. We can teach procedures. We can refine techniques. But empathy, that has to come from within. Rebecca's shoulders sagged, the full weight of his words settling over her. She thought of the faces of the patients she'd brushed off, the colleagues she'd dismissed, the junior nurse she'd humiliated. In her mind, she justified it all as part of the job, but now she saw the cracks in her reasoning laid bare. I, I need to do better, she said finally, her voice trembling. I realize that now. Dr. Jackson nodded, his expression unreadable. Acknowledging the problem is the first step, but words mean little without action. He glanced briefly at the other evaluators before continuing. You'll be required to attend mandatory training on patient care and workplace collaboration. In addition, your interactions will be monitored closely over the next quarter. This is your opportunity to make meaningful changes, Nurse Carter. Don't waste it. Rebecca nodded, her head bowed. I understand, she said quietly. Dr. Patel leaned forward slightly. You're dismissed for now, he said. Rebecca stood shakily, clutching her folder to her chest as she walked to the door. Her steps felt heavy, her mind a whirlwind of regret, shame, and determination. As the door clicked shut behind her, the tension in the room began to dissipate. Dr. Jackson exhaled softly, leaning back in his chair. His expression remained composed, but there was a flicker of something in his eyes. Hope, perhaps, that this moment would serve as a turning point. We've done our part, Dr. Patel said quietly. Now it's up to her. Dr. Jackson nodded. Let's hope she makes the most of it. Rebecca walked out of the evaluation room and down the quiet hallway, her footsteps echoing softly against the linoleum. Her hands were clammy against the edges of the folder she clutched to her chest, her mind replaying Dr. Jackson's words like a looping recording. Skill without compassion is a liability. The phrase stung because it was true. She paused by a window overlooking the hospital courtyard, her reflection faint against the glass. The confident, efficient nurse she thought she was now felt like a distant memory, replaced by someone she barely recognized. Someone forced to confront the harm she had caused. Her gaze drifted to the bustling activity below. Patients being wheeled to appointments, nurses chatting with families, doctors flipping through charts. Each of them, she realized, was carrying their own burdens, their own stories, and she had brushed so many of them aside. Rebecca exhaled shakily, her thoughts interrupted by a familiar voice. You okay, Carter? She turned to see Maria, her colleague from earlier, standing nearby with a clipboard in hand. Maria's expression was kind but cautious, as if she could sense Rebecca's turmoil. Rebecca hesitated, then nodded slowly. I will be, she said, her voice subdued. Maria tilted her head. Tough review? Rebecca gave a bitter chuckle. You could say that. I've got some things to work on. Maria smiled faintly. We all do. That's the point, isn't it? Rebecca glanced back at the window, her grip on the folder loosening slightly. Yeah, she murmured. I guess it is. Later that week, Dr. Jackson walked briskly through the hospital, his usual calm presence commanding quiet respect as he passed by staff and patients alike. As he approached the nurse's station, he noticed Rebecca speaking with a patient in one of the nearby chairs. Her tone was softer than he remembered, her posture more open. She crouched slightly to meet the patient's eye level, listening intently as they spoke. She nodded as the patient gestured toward their arm, her expression thoughtful. Ellis paused a few steps away, watching the interaction unfold. He couldn't hear their conversation, but it was clear from Rebecca's body language that something had shifted. When she finished, the patient smiled, murmuring a quiet thank you before walking toward the waiting area. Rebecca stood and turned, catching sight of Dr. Jackson. For a brief moment, her expression faltered, but then she straightened, walking over to him with quiet determination. Dr. Jackson, she said, her voice steady but humble, I just wanted to say thank you for holding me accountable. Dr. Jackson studied her for a moment, then gave a small nod. Accountability is the first step, but the real work is what comes next. Rebecca nodded, her grip tightening briefly on the clipboard in her hands. I'm ready for it. Good, Dr. Jackson replied simply, his tone carrying just enough warmth to show he believed her. He watched as she returned to the nurse's station, a quiet sense of satisfaction settling over him. Change wasn't guaranteed, but Rebecca had taken the first step, and sometimes that was all it took to start a ripple. As Ellis continued down the hallway, his focus shifted back to the next challenge, the next patient, the next moment where compassion could make all the difference. Final note, Rebecca's journey wasn't over, But the seeds of growth had been planted. And for Dr. Jackson, the experience reinforced his belief in the power of accountability, not just as a tool for correction, but as a catalyst for transformation.